Next is the passive compression test, and not to be outdone by the passive distraction test. This test involves taking the head of the humerus, cramming it up underneath the acromion, and adding a bit of external rotation to the process. So it creates almost a grinding mechanism. And again, the confirmatory findings are pain or a painful click in the glenohumeral joint. This test specifically is for SLAP lesions, again, superior labral, anterior to posterior. The sensitivity is 82, the specificity is 86, and this is that rare test that for these a non-lethal musculoskeletal condition like a SLAP lesion, it is both valuable as a positive and as a negative test because the positive likelihood ratio is above 5 at 5.86, and the negative likelihood ratio is close to 0 at 0.09. So a very solid test. This is called the passive compression test. This is also for a SLAP lesion in the shoulder, and although we've listed this as a specific test, which it is, both the sensitivity and the specificity are in the 80s, which makes it good for both ruling in and ruling out a SLAP lesion. The purpose of the test is to reproduce, especially in throwing athletes, the peel back mechanism that happens in the superior labral region as they throw to cause injury. So it's about 30 degrees of abduction, and you externally rotate to maximum. Once you get in this position, you are stabilizing on one side, so you're really stabilizing the glenoid fossa. And while you're stabilizing that, with this arm 30 degrees abducted and in full external rotation, you move into extension and you're grinding, in effect, that superior labral region against the acromion above it. A positive sign is, again, reproduction of pain in the shoulder.